Hi, everyone. My name is Raven Prophet. I have a question in regards to an interagency approach. I want to know if there were any strategies underway that connects different agencies in regards to child welfare, law enforcement, health care providers, and education systems to kind of develop a strategy or an approach to help the exposure and outcomes of foster care youth.
Yes, I mean there are examples of that. Sort of depends on the age you're looking at. There have been, 1,000 flowers have bloomed and died in that collaboration, coordination effort over the years. Right now, I would look to states that have chosen to extend foster care to 21. And the reason for that is I think that forces states who, whether they like it or not, they quickly realize if we're actually co-parenting, if you like, or serving as corporate parent for a young adult, we better have the workforce development and health and mental health and higher education and training folks at the table. Otherwise, we have to reinvent all of that. And so, there are a number of states doing that. I think a good resource to look toward to get some ideas in that regard is the Jim Casey Youth Opportunities Initiative. They're partnering in a number of states, and Governor, actually there was just 2 days ago, there was a meeting at the Capitol, and the governor of Delaware was there, and he brought all the systems you just mentioned together deliberately to try to focus on coordinating efforts for this particular population.
I was saying more on a local level, like within states and local foster care agencies.
I'm sure there's stuff going on. I mean, the place I would look to is Allegheny County, which is Pittsburgh, because they have a human services administrator there who has control over most of those systems, not all of them, and he's been around a while, long enough to knock some heads together and get people to coordinate. So that's one place I would look to. I'm sure there's other localities that focus on it. There's some county-run systems that do a better job of this than others. So the county-administered states, I would look to some counties in California, for example. Alameda County does some good work.
I would just add that, for example, in Chicago, there was a big movement to try to keep kids as part of permanence in their own school systems. Thank you. To keep kids in their own school systems, and so there was a lot of collaboration, particularly with the educational, with CPS, Chicago Public Schools, to try to collaborate about how do you make good decisions about where kids are going to live, but also not move them outside of their, so if you're going to keep one thing not constant and be crazy, how do you at least allow some permanence and stability and coherence at the school, which is such a primary context for children. And so that required quite a bit of collaboration between those systems. But in that same place, there's not a lot of collaboration between the JJ population, or limited with mental health service systems, and a really poor transition of older youth in care from child serving mental health systems to adult. So, you see pockets of collaboration that work really well with some systems, and then it's like, why do we not generalize this to other, sometimes that's personalities involved and histories and politics as much as it is just, I don't think people don't do it not because we don't know that it's good to do. But I think there's a lot of unevenness, as Mark hinted to.
Just as an aside, the incentives, what are the incentives for those other systems to, other than we have politicians telling them, in the absence of somebody knocking heads together, you really have to wonder what the incentives are for a lot of these other systems to work with a particularly vulnerable population. You hear that in anything, housing. Why would a housing authority decide to deal with youth when it can deal with older people who might be perceived of, if not present a lot fewer challenges, right? So I think one whole issue is what are the incentive structures for education and all these other systems to serve these populations? How can we align metrics by which we hold these systems accountable?
Kevin Bauer with Europe, formerly of the Latin American Youth Center, worked with youth aging out of care. And I actually just would want to expand on what was already introduced, but just ask, I guess specifically in regard to what Professor Samuels introduced earlier about concerns about a relational or developmental approach. Are you guys seeing that systems that are extending the age of emancipation to 21, they're doing anything with that time? Are they taking those concerns into account? Or have we not really seen time for that to build out at the national
So I think it's a great question. I think it's still a little early to know, and I think that it's just been with the recent administration and the IM that came out on well-being that states are also being required to report on those sorts of outcomes. I think in the past we used to report on safety, achievement of physical safety only, and achievement of legal permanence only as being correlates or synonymous with achieving well-being. And so I think there's great variance when I take my dog and pony show on the road to local child welfare agencies and speak the relational, social, emotional, fuzzy stuff, where I have degrees of nodding heads like amen, yes, and we're there, and they're already there, and they can talk to me about things they've been doing for a million years, and I learn so much. And then there's other times where I take it to equally intelligent and, you know, well-organized systems, and they'll look at me like, that's not our responsibility. Why do we have to care about well-being? Well, because it's in policy. Policy says well-being. So I think there's just huge variance around, even though we have, I think, the policy framework for these things. I don't think what we need for this population is necessarily more policy, but rather really deep thinking about everyday practices, even outside of the context of interventions, but that are everyday practices that matter deeply for this population. And how do we think relationally and developmentally, even if a kid's in the system for 2 months? And I think that that's a cultural shift that's happening. We used to push permanence, right? Because kids were languishing in the system. And so we thought, that's what we got to do. Get them out, get them out, get them out. And now we're like, well, are they better just because they're not here anymore? I don't know. It's a debatable question. Sometimes yes, sometimes not so much. So I think there's huge variance, and we don't necessarily all study that in the same way. And so we have different levels of data in different places. The Midwest study is really great because we have this Midwest pod, but what's happening in Tennessee, is it like Wisconsin? Maybe. Mm-hmm.
Just a follow-up question. Is it your sense that there's any relationship between the sorts of placements that are preferred in a system and the kinds of work that's being done? So group homes, for example, versus a shift towards kind of independent living programs or things of that nature?
I think there's huge variance, and I think there's huge assumptions about what goes on there and what's the worry and what's not. I think that we assume that everybody who gets adopted, it's great. Yeah. There are no problems there. And so we tend not to study it quite as quickly. Or kinship care, relative care. We think, hey, if you're related, you know what to do. Well, not exactly. And so there's certain questions that we tend to ask because of our worries about what's happening. So we're really good at asking questions about, how do you feel about family and being connected with aging out? Because we know that there's not that legal presence. We don't ask those kind of questions of kids who get adopted because we assume it's there, even though necessarily it's not. We assume that group care is horrible, but maybe for some kids it's not. What does good group care look like? And so I think there's just, we've studied things in such silos that we've constructed then our worries and our solutions in those silos without asking across the board what's happening and what are the distinct characteristics of kids who have those placement conditions, and what are maybe some shared things that are just about growing up in a very different family context with 3 or 4 different circumstances and being disconnected from your biological origins, which are shared across all those. Are you wanting to add anything?
Yeah, one statistic I want to add that's shared. 75% of older adolescents in foster care are close to at least one adult relative. 60% see their mom once a month. I'm so happy my mother's never been in one of these things. I did not see my mother once a month when I was that age. So one of the things, I think one of the myths that's easy, and I didn't say it and you didn't say it, is older adolescents in foster care by and large entered as adolescents. They have families. Juvenile justice system, a lot of these so-called vulnerable populations involved in systems, homeless young people, right? And one of the reasons they're homeless is they weren't getting along with their families, but most of them still have families. The sort of image of orphans or psychological orphans, my data suggests that's maybe 1 out of 5 kids aging out of foster care, right? That the vast majority have ongoing relations with family, and it's how do we help them manage those and support them. So one more question real quickly. You got somebody behind you there?
Hi, everyone. Christy Arnold again from Europe, NCR. And actually, Dr. Samuels, this is kind of in keeping with, I guess, a consistent theme question that I've had over the course of the workshop. I was reviewing the techniques that you were saying that are used as it relates to the mental health aspect of working with foster care youth, and particularly the, I think it was the relational skills, healing, and things of that nature. And so so my biggest thing is, what have you found to be best as it relates from a cultural lens? I would imagine many of the youth, and let me say that I worked in foster care as one of my first jobs coming out of graduate school, and I shared with you, I think it is the ultimate rites of passage
I agree
position.
with you.
I think
For every
everybody at
social
some
worker,
point, right, whether you're a social worker, whatever your background is, it is definitely a job that teaches you more skills than you could definitely get in the classroom. So to that point, I found that most of the children that I work with were of a wide variety of racial, ethnic, religious backgrounds and things of that nature. So when I think of something that is going to build upon a skill or healing in any kind of way, I would immediately go there because I would figure, or I would probably assume, that it would be the best way to really reach the child and connect them with some of the things of their past as it relates to family norms or cultural norms that they remember that might be beneficial for their healing process. So what have you found on a cultural level? And again, that includes their religion and everything, the wide gamut of cultural aspects that can help with that healing process.
Mark's gonna. Did you say you had something? Oh, he just told me to be quick. So, because he knows me. So I'll just say really quickly, I think actually, Mark, Mark has some interesting data around racial ethnic identity, which I was looking at actually in preparation of this. It's shocking. That there isn't necessarily a self-reporting of strong connection, racially, ethnically, culturally. Why that is, I think we could have a really long conversation about. So I won't answer that. But I do think that just in general, there's not a lot of practicing helping young people to. I really like I'm going to butcher this term, but these sort of grounding narratives that someone mentioned earlier, right? I like using that as a practice tool, and that's cultural, but also familial. It could be religious. So how do we help young people develop grounded narratives of their really disruptive lives that engage their healing? And I think that can involve cultural and racial and ethnic elements, certainly. So you and I can gab later.
And I just flagged that, public assistance systems, caseworkers aren't really caseworkers.
Right.
They're
That's a great point.
eligibility determiners, their work participation rate.
Superheroes, that's a better term.
No. But most cases, their job is very, very bounded in what they're allowed to look at. They're really focused on, is the person doing what they need to do to meet the work participation rate? And if someone presents with more complicated issues, by and large, they're not social workers. They don't have the training, and they don't have the time to take the time to work with people. So yeah, it's a very tough job, but it's a constraint as well.
Thanks to the panel.
Thank you.